So today I will be going over a liver pathology called the cavernous hemangioma. Before we start talking about the cavernous hemangioma, I'd like to go over what's normal in the liver. There are arteries, veins, and bile ducts, and the liver plays an important role in filtering blood coming from the digestive system to get rid of waste and retrieve nutrients for our body. There's usually no masses in or around the liver, but the only thing you can see around the liver is the gallbladder, which is obviously not a mass. In that sonographic image, you can see a hyperechoic area, posterior and inferior on that liver. Now I'd like to go over what a cavernous hemangioma is, and what it is a non-cancerous or benign mass found in the liver. It is formed from the tight tangling of blood vessels, and there's no evidence that these masses can cause liver cancer down the line. In that sonographic image, you can see a hyperechoic area that's found what looks to be underneath a part of the portal vein. Now we will talk about how they're formed and if they're genetic. It is believed by doctors that hemangiomas are present at birth. They most likely never grow or change in shape or size. They are typically less than 4 centimeters and only one is present. In rare cases, they can be larger and more than one. It is unclear as to why they grow and cause symptoms in the rare cases that they do. Some of the cavernous hemangiomas are believed to be genetic. In that sonographic image, you can see a large, round, hyperechoic area, and that would be the cavernous hemangioma. How often are these found? It is believed that up to 20% of the population has a cavernous hemangioma. This is very common. Hemangiomas are more common in women than men. Also, women who are pregnant or on hormone replacement therapy are more likely to be diagnosed with one than women who are not. So now we'll talk about how to know if you have one. Most people who have these benign masses have no symptoms at all. They can go their whole life not knowing it is there. The people who show no symptoms of abnormality can find out from incidental findings from other diagnostic imaging tests. The people who do have symptoms will have pain in their right upper quadrant, they can feel nauseous and vomit, and can feel full after eating a small amount of food. Since these symptoms are broad and nonspecific, and hemangiomas are typically asymptomatic, there's a chance that the hemangioma is not actually causing these symptoms and that something else can be wrong entirely. The image on the right is an MRI of the abdomen, and that big white area is what would be the cavernous hemangioma on the left of the screen. Can it cause problems down the line? Some women who are diagnosed with a cavernous hemangioma prior to getting pregnant have had more complications with the hemangioma. It can grow and start to cause symptoms from the high levels of the hormone estrogen being released into the body. This does not mean that you cannot become pregnant, only that there may be complications with your liver during the pregnancy that may lead to symptoms that need to be treated. Some also believe that birth control can cause the hemangioma to flare up too. So what's the patient's prognosis? You can live your entire life without knowing you have this and never having one symptom. At the end of the day, the majority of people who have this never need treatment. Those who do only need their symptoms treated. How does it appear sonographically? Cavernous hemangiomas appear as homogeneous hyperechoic masses less than 3 centimeters in size with acoustic enhancement. These masses are round or oval with well-defined borders. There is low-velocity blood flow that is too low to be seen with color Doppler, which is beneficial because it can help distinguish a hemangioma from a malignant mass. Larger masses can show necrosis, degeneration, or calcification. The image to the left is a microscopic image of a cavernous hemangioma. Within the middle, you can see the liver parenchyma, and then you can see these big circular spaces containing blood. And then the pink spots around the blood are endothelial cells. This is my works cited. So for the creative portion of my project, I would like to bring your attention back to the microscopic image of the cavernous hemangioma. And to me, it looks like those toys that you get out of the vending machines at your local Mexican restaurant. So the cloth would represent the liver parenchyma and the endothelial cells, and these orbies in the middle would represent the trapped blood cells.